to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. So in today's video, as you may see, it's a little bit different. I want to do a visual depiction on the factors that make trauma therapy work, specifically for people with dissociation, because that's a really complex form of trauma therapies because we have to factor in the dissociation, which means nothing is simple. Now the CTAD Clinic stands for Complex Trauma and Dissociation. So what we're looking at here is a way of being able to depict complex trauma and the complexity of the therapies that are then needed in order to meet the needs of the trauma. So the more trauma a person has, the more complex the therapy might be. Now this doesn't have to be in complexity in any one particular form, and what I'm going to show you through the stuff that we've got here is how we represent trauma therapy and how we feel that certain things work and certain combinations work, and the intangible and the tangible components of that trauma therapy. And this has been done largely through learning from our patients. So people with trauma, people who have come into our service, have told us in feedback what worked for them, what didn't work for them, and we're constantly working to address this and try and make sure that we can provide the best situation possible. And some of it are very, very controllable factors and some of them really aren't. And I want to show you, using these materials, this scales, this balance and these weights, how we understand the different components of trauma therapy in order to be able to bring the person to recovery or healing, or to get them to where they want to be within their dissociative processes. The way I want to start looking at this is by showing the comparison between complex trauma and simple trauma. So I'm going to use this 1 pound weight, right, which is a fairly solid thing here, as you can see. So this weight, this represents trauma. So we're thinking about this as being represented by a simple trauma. So this is the kind of car accident or assault or something. By simple I don't mean minor. This can be profoundly debilitating, but it is simple in the sense that it's a one-off event that takes place, rather than complex, which is a series of events. So complexity is simple at this stage. So I put this down here on the scales. So here we can see that the weight has completely tipped the balance of the scales. So we think that complex trauma requires complexity, simple trauma requires simple, so an equal and opposite level of trauma should be enough to balance the scales. So when we put a weight on of equivalent size, what we see is that there's a tipping of the scales. Because we understand this, so that it's not quite the same. So we've got one weight for the trauma, one weight for the trauma therapy, and yet there is something missing from this. So we're going to try and work out, using our process, to figure out what's the missing component here. The trauma therapy should be enough to balance the needs of the trauma, and yet, as we see in clinical practice time and time again, it's not really just about that. This will be considered to be the tangible factor in trauma, and the intangible factor has yet to be added in. Okay, so if I take these weights off, we get back to the scales being balanced again. So this is, everything is going completely and utterly fine. And here we have the different components of the trauma therapies that can take place. So what we're looking for is a balancing of the scales. We have our trauma, our weight, and we have our different components of the package of trauma therapy, because trauma therapy isn't just one thing, it's a package of things. So I'm going to talk you through what these different things are step by step. Okay, so this is our weight, these are our different components of the trauma therapy. So in no particular order, I see them as being 7 factors realistically. So we have the psychoeducation needed, so it's the level of the information that's been given to a patient about the nature of their condition. It could be this, which is actually being diagnosed with a condition, so understanding that that diagnosis is correct and is present. We have the techniques, so the actual modalities, so this could be things like cognitive analytical therapy, cognitive behavioural therapy, mentalization therapies, dialectical behaviour therapies, internal family systems. It doesn't really matter, there's a whole load of different therapies, so that would, say, take over what the therapies are. This could be the actual physical space that the session is in, so the consistency of the same room over and over again, and not all services can provide this. So being in the same room over and over again, that's part of it. We've got this way as being the accessibility. Are you actually able to get into a service and access it, get through the referral pathways and be able to have that available to you? This is the amount of time that is available. So some services limit the amount of time that's taken. So you might get, say, 5 sessions or 10 sessions, or in a service like ours, you might be given 2 years. So the amount of time that is available to you. And then this one here could just be the experience. So how long that therapist has been working and how long they've been doing the job and how experienced they are working in this specific field. Because it is important. So, you know, the relative size of these is not the case. One, you know, just because one might weigh more than another doesn't make any one or less more important. The individual patient maps these constructs as in different levels of what is particularly important. So for one patient, this might be the diagnosis. For another patient, this might be the diagnosis. Really doesn't make any difference at all. And then this little piece here, that is the intangible factor. That's the thing that you can't be trained on. That's the thing that a book won't give you. That's the thing that we're going to come to as being key within this process. So I'll talk to you about how this all works in a second. Okay, so we're now looking at complex trauma. So this is the weight of the complex trauma. So it's a sizable thing. Again, it doesn't matter how many traumas have been enacted upon this person or how whatever this is, this simply symbolises a weight of experience. So this is the level of complex trauma that is being held by a person in our service with dissociation. So it's the combination of the dissociation, the trauma, it's pretty much everything that we need to work on in order to have this successful therapy. So this is, we're trying to build a picture of what successful therapy is and looking at the components of that. So if we take one of these features, so let's say this could be the experience of the therapist, how good the therapist is, how many years they've been doing this work. So you put that into the tray, it kind of makes no difference whatsoever. So we think about another one, we say that could be the diagnosis, we put that into the tray, again, it makes no real difference whatsoever. We put this piece in here, which could be the space, this could be the time, this could be the accessibility, the other factors that we were talking about, they all go in there. And they're starting to make a difference, but yet something is missing. So again, we come back to this intangible component here as to what it is that's making the difference. Now, before going to the great reveal and leading you to what that is, I'm going to show you something else about this intangible factor. So one of the things that is said quite a lot when thinking about talking therapies is, well, what's the difference between a friend and a therapist? Why can't you just hand your problems to a friend and they'll solve it all for you because they're going to sit with you and be your friend? And we generally as therapists say it's not ideal that that works, right? Friends can do an awful lot, but friends really aren't recommended to be the people that you'd want to be your trauma therapist. So your friend, your trauma therapist, is not a great idea, no matter how well-meaning that friend is. Now, we're not pretending to be friends. As therapists, we're not people's friends, but we act in a specific way which is friendly. And that's what this is all about. This last factor, the intangible component, is the relationship. It's how much this person carrying the trauma and the dissociation feels that the person that they're sharing their information with cares about them. How interested, how invested, how committed they are to the process and the person. Do they get on? Is the fit correct? Are they a good person? Are they genuine? Are they sincere? Are they trustworthy? Will they go the extra mile? Will they do what is required within all the boundaries and all the professional competencies in order to try and help this person? But if we're thinking about just this on its own, all of those factors, without all the therapy stuff, you get all that in a friend. The best mate will be all of those things for you. But when we put back in the tray, that on its own makes absolutely no difference. And that's why we think this is the problem. It's not just those factors alone. But watch what happens when we build the picture back up again using all of those tangible factors about the diagnosis and the space and the experience and the accessibility, all of those different factors that we went through at the start. We put them all in the tray. And you can see that something's happening and it's making a difference. And then when we add the intangible factor, this is what happens. So when we factored in everything, right, all the techniques, all the diagnosis, all the room, space, and absolutely everything, the one thing that's left behind is this intangible factor. This is how much the person delivering the therapy genuinely cares about what they do. And this is the thing that we learned from our patients over the years is what really makes the difference, because all of this is important and has to be there, but the gel of these things, these are like the ingredients in the cake, but the cake hasn't been baked. It's not happening yet. They're simply ingredients. Something has to gel them together, and we're told time and time again it's this thing, and it's small because it's invisible. No one can see it. I don't think you can really be trained on it. You've either got it or you haven't. And I think this is what makes trauma therapy so successful, because when you add this to the plate, that's the thing that tips the scales. That's the thing that makes the difference. This is the smallest, lightest piece out of all of these weights, and yet that is the one that's tipped the scales in the balance of favour of the trauma therapy. And if we take that out, the scales go back to being imbalanced in favour of the trauma. So this smallest piece, this intangible factor, the caring, the sincerity, the genuine qualities of that therapist, their ability to be present in the room no matter what trauma is being discussed or described, to be able to hold it together and be there for that person, given all the boundaries and all the correct setup of the therapy. It's that we believe makes the difference. Okay, so I'm not saying that these 7 factors are the only 7 factors or the most important ones. So off the top of my head, I had 7 weights and there I put 7 factors together. There are going to be more. I think I've pretty much gone through what the main ones are. And I'd like using a visual depiction of this to be able to show that the reason that trauma therapy works isn't about one single construct, it's about all of the things put together. And when we're looking at complex trauma, there is a package that we work with. A lot of people say to me, well, what exactly is the trauma therapy for complex trauma and dissociation? And I say, well, how long have you got? Because it's not a simple answer. It makes a real difference that you have this package. And if we go back to the PTSD, if we think about it in those lines as well, back to where we started. We have the simple PTSD, trauma, and we have the, let's say, trauma-focused CBT. That's the therapy. People are trained in doing that. To deliver that, it should work. And it kind of doesn't. And then if we add this tiny, tiny factor again, you can see that that makes the difference. And this is the principle of it. If we remove this intangible, invisible factor from trauma therapies, I just don't think trauma therapies are that effective. And if we add this intrinsic factor to the simple trauma therapies, that's what makes the difference. But on its own, it doesn't. So that, in combination, solves the PTSD issue, solves a complex issue. It's this which really works. So I hope this has helped. Again, it's just, it's something that we've picked up through the clinical practice of doing this work for many, many years, learning what we've learned and understanding and listening to the patients that we've worked with along the way. I really hope that this has just proved a useful thing for you in either as a therapist in terms of what you're delivering or as a patient in terms of what you're receiving, is to have this sense of all of these different things emerging together, coming together and being meaningful in their own right. So as with all things, please leave comments about this video in the section. Please like, subscribe, share, do all the usual things that you want to do, and we'll keep delivering our videos which we hope are going to be as useful to you as possible. And between now and the next video, please do take great care.